So, have you ever heard of a condition called bronchopulmonary sequestration? It's this rare lung issue in babies.
Can't say I have. What's that exactly and why is it
Go on.
important?
Well, it's when non-functioning lung tissue forms during development but doesn't
Right.
connect to the airways.
So the tissue just sits there not doing
Exactly.
anything?
Yeah, it's kind of like having an extra room in your house that you can't even
Hmm.
enter.
That's an interesting analogy. So what's the problem
Thanks.
with it?
The issue is that it gets its blood supply abnormally from the aorta, which can
Oh,
cause
okay.
complications.
Like what exactly?
Well, it can lead to breathing problems, infections, even heart failure if it's large.
That's serious? How do doctors find out about it during pregnancy?
Good question. They often detect it during routine ultrasounds around 18 to 20 weeks gestation. They
Makes
might see a
sense.
bright spot in the chest.
And then they do more tests to confirm it?
Exactly. Yes, high-resolution ultrasounds, fetal MRIs to get a clearer picture.
Right. Do we know what causes this condition?
Unfortunately, actually the cause is unknown.
Really?
It's not linked to genetics or anything like that.
That's surprising. I thought we'd
I
have
know.
figured it out by now.
Yeah, some things in medicine are still a mystery.
True.
They believe it starts when an extra lung bud forms during development.
So are there different types of this sequestration or is it all the same?
Yes, there are two types, intralobar and extralobar.
Okay.
Intralobar forms inside the lungs, extralobar outside.
Does that affect treatment or prognosis?
Absolutely. It does. Intralobar usually requires surgery after birth.
Right.
Extralobar might not need surgery if they're small.
But wouldn't it be safer to remove it anyway to prevent
You might
future
think so.
issues?
Well, small extralobar lesions may not cause any
I
problems,
see.
so doctors might choose to monitor them.
I still think removing it could prevent future issues, don't you think?
That's a valid point. Yes, some doctors do recommend surgery to avoid potential complications. It really
Yeah.
depends on the individual case.
Can they treat it before birth if it's serious or is that
In
too
rare
risky?
cases, yes. If the mass is causing severe issues like fetal heart failure, they might perform fetal intervention.
Wow. That must be challenging and requires a
is.
specialized team.
Absolutely. Procedures like the exit procedure allow surgery while the baby is still connected to the placenta.
Incredible. What's the long-term outlook after surgery for these kids?
Generally excellent. Most children do extremely well and have normal lung function.
That's
Early surgery
reassuring.
helps promote lung growth.
It's amazing how resilient the human body is,
It
especially in
truly
children.
is. With proper care, these kids can lead healthy lives. It's heartening to
Absolutely.
see.